Hi, everybody. I'm going to make some jokes, just so everyone knows. If I can get my slides. There we go. Okay. All right, so these are my disclosures. I also want to disclose I got these awesome wiener socks from Pathright Medical today at their booth over in the Science and Technology Hall. Thank you, Chris Yang, for pointing that out to me. All right, so I started practicing in New Hampshire 9 years ago, and what I didn't know going into that practice was that everybody in New Hampshire has both Peyronie's and ED. It was very horrifying for me because I didn't see a ton of Peyronie's in either my residency or fellowship. And don't let these glasses fool you. I have the appearance of being a smart man, but in reality, there's not a whole lot going up top here. So I had to figure this out pretty early on and figure out what I was going to do in the land of crooked penises. So what I started with was what I took from BU, where everybody gets a preoperative penile ultrasound with Ricardo. And then from there, I went and looked at what the legends do, right? So I looked at Dr. Wilson's modeling information and papers on that, and of course, Dr. Pareto's scratch technique. And that is pretty suitable for, again, as pointed out previously, lower range curvatures. But for higher range curvatures, you need to be more advanced. And so Dr. Brock pioneered a technique as well that Dr. Warner has adapted for use with penile implants that is really excellent for the significantly curved patient. So let's talk about modeling, right? Modeling's got a lot of haters out there, and I don't understand that. Modeling is easy, it's simple, and a lot of the work gets done both in the OR but also after the fact. And if you have concerns about modeling like urethral perforation or you can't get certain curvatures fixed with this, I would point to these 4 papers right here which clearly elucidate that modeling is very useful and effective. The scratch technique also pioneered by Dr. Pareto and is also very excellent as an adjunct maneuver for modeling, and it really, really helps reduce curvature further. There, of course, are multiple references to this as well. Dr. Pareto uses a number 12 blade, this sort of scimitar, to help carve through the corporal tissue and the plaque. I use a dental pick, which allows for both longitudinal scratching this direction as well as transverse cutting in this direction as well. The problem with the dental pick is it's very pointy, right? So there's no leeway here. The guy has to have a plaque seen on ultrasound, and if you push hard enough, the guy will have a dorsal appearance of the pick, which is very significant. So just be very careful with it, but it's a very useful tool for scratching. The Brock technique was originally pioneered by Dr. Jerry Brock for purposes of patients who just had Peyronie's and were not getting an implant. And then Dr. Warner has adapted that further. So what he does is, with the Brock technique, you identify the point of maximal curvature, then you make distal bilateral corporotomies, right? And you sort of carve the spongy tissue off of the plaque, and you go across. Usually I use a nasal speculum to kind of spread the tissue open so you can really visualize everything. And you're making these transverse incisions. So you're taking it and you're accordioning the tissue like so, and you're essentially making the short side longer. Right? So this is the solution to all these problems we're talking about. Do you want to make the penis shorter? Do you want to make the penis longer with these elaborate techniques? You can make the penis longer simply by just fluting across it and giving yourself some nice transverse incisions. So again, with that, what Dr. Warner does is as he's pulling, he's measuring and seeing that the dorsal surface or whatever surface is getting longer as time goes by. And then he does close those corporotomies up and puts his implant from there. So modeling is easy, low risk, and potentially high reward. The scratch technique augments the efficacy of modeling quite a bit. But for more severe cases, the Brock technique works very, very well. And elaborate methods, as described previously, are labor-intensive, time-consuming, and high risk. These are my bibliography here. And of course, please, if you don't mind, if you have time, please take our